First of all, the most important thing to remember and to know is that we all have attachments in our mouth, which we call frena. The question is not, do we have this anatomy in our mouth? It's more a matter of, does this anatomy affect the function in an infant, in a child, and or an adult?
Our general recommendation for frenectomies is to address functional problems, releasing these tissues and make them functional to help a baby and a mommy be able to have a journey of healthy nursing is very rewarding.
Some examples of baby symptoms may include a poor latch, milk coming out of the sides of the lips, clicking noises when they're nursing, gassiness, colic, reflux, and other symptoms as well.
Performing a frenectomy can be addressed at different ages. For example, a newborn may be having a lot of trouble with a good latch and nursing. Then later on, a toddler may have problems articulating clearly, appropriately for his age or her age. Or even later, a child may be having trouble swallowing properly because the tongue may not be functioning the right way. And even go to adolescence where they're hitting a growth spurt where they can no longer use their tongue to move it around the mouth to clean it, and sometimes they have to even use their fingers. So it changes over time as the child grows.
When we do our exam and we do our evaluation, we're looking to see if there's a restriction of the lip, the tongue, and even we can evaluate the cheeks as well. There are buccal ties in the mouth too. And when we look at that and we compare to mom's symptoms and baby symptoms, that's when we determine if a lip and or tongue or cheek tie release is needed. When we do a release on an infant, we use an invisible light called a laser. So nothing ever touches the tissue. We actually shine the light just a few millimeters away from the tissue, and what happens is it slowly begins to melt away the tissue. Using the laser is really considered the gold standard when it comes to tongue and lip tie releases because it results in less damage, collateral damage to the adjacent tissue. We're generally able to do a complete release. There's generally minimal bleeding and the healing is improved.
There are many benefits about releasing a lip and tongue tie. Perhaps even most importantly will be the correct growth and development of the face and the palate. The tongue, when it's released and it has proper motion, if that is accomplished, then we're going to have a really good growth of the facial bones.
We want a successful outcome for the kids, and in order to achieve that, we really do need a collaborative approach. And that means we need to bring on our team of specialists, whether it's a speech therapist, a feeding therapist, an ENT, or a myofunctional therapist. It's important that we partner with other specialists in order to achieve the end result, which is a successful outcome of the release of the tongue, the lip, or the cheeks.